And Jennifer, you'll be able to see all the comments over here. You can also reply if you want to. And when you reply, it will reply as you. Don't even worry about that little number up there, viewers, because it's always bigger than what that number shows.
Y'all famous.
No, it's the leather jackets.
They need to know our community.
I thought it might be the hat, but
wait, hold on. I have that exact jacket right here.
I have a leather jacket upstairs.
Wait, hold up.
We could be team leather jackets if we need to be.
Oh, y'all ain't ready. I'm trying to get my grandma look right. I have a leather jacket upstairs. There he goes. Alejandro's gonna be here too. Isaiah in the weight room in the backstage, just checking us out. Oh, Dr. Antoine got it going on.
Let's see. Oh, we can't because we're live.
No, it's okay. They can hear us, but
they
that's
can hear us
for people to know that we're starting in 3 minutes and 49 seconds.
Letting them know that we're going to do an hour of rapid fire in just a moment. Lots of community kind of requests for more information regarding the vaccine and how they can prepare for it. And so in 3 minutes and 36 seconds, we're going to be having some conversation with Dr. Denis Antoine and Dr. Jennifer Edwards Johnson. So I'm excited about it. You can tell us in the background talking about these leather jackets that we kind of laid back kicking it right now. So it's going to be fun.
We all family. Is that what that's what it is?
Once I found out you were in J's and y'all out here buying J's during COVID, then I know what it is.
No, that is, yeah. We have J's and he bought a pair of Turtle Dove Yeezys. That was the COVID purchase.
He got the Yeezys. So I didn't get any Yeezys during COVID. I'm trying to think. I got a whole lot of classic stuff during. I probably did way too much because I've been at home.
Denis, I want to give you a heads up. We've already had a request from some of our folks in the behavioral health community here to save this. So it's going to be also broadcast live on YouTube. And they want to share it with their recovery community and some of their behavioral health community. We might get, and we'll probably have a lot of those folks on. So we might have some questions around that as it relates to COVID and vaccine and mental health. People are real excited to hear from you. I can't wait till we put your face up and they see who they're actually talking to. Denis, can you say something so I know your volume's working? Denis.
You got 2 minutes to fix it, Deborah.
No pressure.
How is my audio? I'm not I don't have on a headset or my
Your audio sounds great.
You sound great.
Okay, I'm gonna just stick with the computer. I just text him. I need him to say something.
Can you hear me?
Yeah.
All right.
Testing.
I could hear you.
Say something.
Can you hear me?
Yeah.
Got it. Twice.
All right.
Hey. Testing.
Hey, Denis.
Yep.
I could hear you.
Wait, can you guys hear him?
Yeah, but I'm hearing a delay. Like I'm hearing almost like a 10-second recording of what we said.
Yeah, I'm hearing you ask him if you can hear him right now.
It's because somebody has their Facebook playing.
Oh, let me make sure. That's an interesting point.
Denis, can you say something so I can see if I can hear you in live stream?
Can you hear me now? Nothing?
I can hear you.
I can hear you. It's not great though.
And I can hear you as well. It's a little lower than.
Oh, hold on. Okay. Any better? Is that better?
It's a little better. I wish it was louder. Oh, they chiming in. Hey.
Yeah, Deborah, you are echoing.
Uh-oh.
Hey, Tanae, how are you?
Am I still echoing?
Not now.
Great. Because I'm always going to make sure it's right by the time we start.
So Deborah, is Sean our cuz or your cuz? Just
Sean Massetti is an alias. He might be in Facebook jail too. That is my bio cousin. And if you could see his face, the eyes and the nose would tell you we are highly related.
I just making sure it wasn't Ray again. Because Ray be sneaking us sometime, man. Ray Boone jumps on every now and then. Hey, so great to see you all, Dr. Jennifer Edwards Johnson, Dr. Denis, Antoine. Welcome not only to what has been an opportunity for folks in Flint to kind of get engaged and connected to resources and information regarding the vaccine. As we know, we have to make sure that people have the best knowledge available as they're making this tough decision, the decision between whether or not they're afraid of the vaccine or if they're afraid of COVID the most. And so as people are navigating that, we have been offering this platform as an opportunity for folks to ask questions and hear conversations about or from experts in the space. And so thank you all for being here. Dr. Deborah has always been an amazing co-pilot in this space. She is on with us right now. She might jump to the background a little bit and try to do some of the production work, but she's always here as a resource as we move forward. So we can jump right in this. I'm going to try to keep this to an hour because if you keep it under an hour, people return your calls when you call them. So I'm going to try to keep this under an hour. But if we can jump straight to a bit of an introduction. And so I'm Isaiah Oliver. I'm president and CEO at the local community foundation, where I lead an organization focused on engaging people in the world of philanthropy, giving time, talent, and we tend to highlight treasure. But in this case, we are talking a lot about the time and talent of folks like you all who are giving that to ensure that people in this community have what they need to make the best decisions. And so I'll ask you, Dr. Jennifer Edwards Johnson, to introduce yourself to the listening audience.
Absolutely. Jennifer Edwards Johnson. I'm a family physician and I'm the community assistant dean of our Flint campus of the MSU College of Human Medicine. So our students are in the community. They're at our community hospitals. They're at Hurley, they're at McLaren, they're at Ascension. They're doing great work and we appreciate the community for engaging our students and letting them be a part of the process, and for the community for helping our students learn.
Thank you so much. Dr. Antoine.
Thanks so much, and hope you can hear me okay?
Yes.
All right. So yes, I'm Dr. Denis Antoine, and I'm coming from Baltimore, Maryland today. I'm an addiction psychiatrist, as the title says there, and the programs that are mentioned are all associated with treating persons in the community, homeless persons with substance use disorders, and also mental health issues, but also the Center for Addiction and Pregnancy, which speaks for itself in terms of title. But my work really focuses on working with people in the community and making sure that the needs, especially of those that are underserved, are met.
Yeah. And so I want to make sure that I lift that up and we see all of the information related to Dr. Denis Antoine here, addiction psychiatrist, director. If you could show that again, Deborah, Director, Center for Addiction and Pregnancy, Director of Cornerstone Clinic at Helping Up Mission. And so I think we talked quite a bit in an earlier episode, I'm calling these episodes now, about pregnant women and breastfeeding women. And so if you have pregnant or breastfeeding women in your life, please at this moment, just share to their Facebooks. Maybe they can jump on, ask questions as they have them. But I'm going to start off here. And Dr. Deborah, I'm going to pull you right out of the background because we have a Flint kind of focused vaccine related question here. It's about the sites that are opening up regarding the vaccine soon. As you know, in the last time we were together, we told people to watch for the 5 o'clock rollout. It was going to be happening on the county health department website. They were going to be scheduling appointments out of that website right at 5 o'clock. And it's almost like the Secretary of State dropped. They dropped that opportunity. You get in as soon as you can. When it fills up, it's filled up. And you got to wait till 5 o'clock the next week in order to do it again. I know they've been focused quite a bit on the 80 and up population. Sure. And they're saying that the 65 plus population might be the next couple of weeks, could be the next couple of months, depending on how many vaccines we get. And I know right now we had like 975 in Genesee County. And so they're basing this on the populations that need it the most. And right now it's 80 plus. But if you can answer this question that Brenda Brown has. Hi, Mrs. Brown. I haven't seen you in a long time. Obviously COVID, but other things. It's nice to see you here. Will other sites for the vaccine open up soon? The current 3 sites do not have any openings.
So I can jump in, and also Dr. Johnson, who has a pending appointment at McLaren, can probably jump in too. Here's what I'm gonna say, because I'm gonna toss it to her. This is why these conversations are important. It's important that people get good information, that they be ready, because when your number comes up, and I warn people about this, when your number comes up and when the opportunity comes up, it's not like you get pushed to the back of the line. But if you're at the deli counter and they say number 5, and number 5 doesn't come up, and they say number 6, now number 6 comes up and number 5 runs up, and where your place is in line gets a little sketchy. So there will be more sites coming up and there will be more opportunities. but it's important that people be ready. I'm gonna hand it over to Dr. Johnson.
And Dr. Johnson, when you answer the question, if you can also answer the question from Florinda Lee Hall, who is my mother-in-law. She's asking, will 80 plus people be able to jump ahead of the people? And I would say that's probably for both my Aunt Joe and my Granny Nona. And so please answer that question about 80 plus people jumping the line.
Absolutely. I appreciate it. 80 plus people are definitely being prioritized. All the data that we see says we need to take care of our elderly population first. So 80 plus people are the people who are getting prioritized. I really appreciate the question about where can you go to get vaccinated. I think as time moves on, you're going to find more places. And as Dr. Furr-Holden alluded to, you should be in contact with all of your resources. That includes your primary care doc. That includes the community, webinars like these. I know a lot of community offices who are already reaching out to their own patients to prioritize them to give the vaccine. There are certain offices who are having vaccine clinics for their patients who are 80 and over. So as people and offices get access to the vaccine, I would expect that that opens up, and absolutely that 80 and older will be prioritized. And in specific offices, usually the number has been 75. And those are starting in the next week, where people in offices are getting prioritized to get the vaccine who are older than 75.
Thank you so much. And so I don't have any questions in right now at the moment, but I have a question. The last time we were on, Dr. Antoine, we had a lot of questions about women breastfeeding. Is there any common message around women breastfeeding? I know there's been lots playing out in the news, lots of questions about what happened. I think it may have been the UK, but I'm not certain. And so some information that came out there. Could you clarify maybe the information that's been coming out and where we stand right now with women breastfeeding? Should they be first round, getting it as soon as possible? Should they be waiting to see what side effects or what clinical trials kind of show up? I don't know. I may not be asking the right question, but I know there were several questions in that space.
I see what you're saying. So if I'm understanding the question correctly, it is the COVID vaccine, does it have any connection or what do we know about it in terms of safety for the for breastfeeding? So I think the first part of that is that the clinical trials that have been performed on the vaccine haven't been done in children, which is partly why children aren't being, the main reason why children have not been put in the line for administration of the vaccine. I know that there is a large amount of immunity that's passed on through breastfeeding, and that's why it's very important. So I would say there isn't a disclaimer out there to say don't breastfeed, but I would say if the mother has some type of adverse reaction or something is not happening right with the vaccine, then it would be a time to consider not breastfeeding. But otherwise, I think moving forward as normal would be what's recommended at this time.
I would co-sign that entirely. All of our, to agree, all of our obstetric society guidelines, all of our pediatric guidelines are consistent with pregnant women and women who are breastfeeding should absolutely still be getting the vaccine. And the part that's important to think about this is you're weighing risks, right? You're considering your risk of getting COVID and the kind of known risk that we know about COVID, symptoms related to COVID, severity of COVID, with something that has, from the data that we do have, a very low likelihood of having a significant risk. I do want to, again, reiterate what Dr. Antoine said, is we don't have that data to tell us, but what we do have is expert opinion and several breastfeeding and pregnant colleagues and people out there who have already gotten the vaccine because they're worried about the risk of COVID. And so all of my breastfeeding and pregnant colleagues and physicians who are experts in the fields, who are OBs, are saying, yes, kind of get in line when you can, like Dr. Furr-Holden alluded to, get in line when you can and don't lose your spot.
So Dr. Johnson and Dr. Antoine, please jump in here wherever you feel comfortable. I will ask, what is this vaccine, or what is this vaccine supposed to do? Is it safe? Because I see a lot of people having some kind of reaction to it. And this is really people seeing things in the news, some things that are playing out, things that are being highlighted. So we've talked quite a bit about mRNA. I probably had too many crash courses at mRNA or the ingredients in the vaccine. But if you could right now, just talk about what the vaccine does to protect community. And I would say both on the one-to-one level, but then from a public health perspective.
Absolutely. And Dr. Furr-Holden will probably have a better public health lens, right? But the vaccine is intended to kind of give your immune system a preview of what the virus will look like, right? And Dr. Furr-Holden has a great analogy for this that I'm going to steal a little bit. It's like, you know, you see someone that you really don't like while you're out, right? You're out and about and you see them and you're by yourself. And you know that you can't take them by yourself, right? Like, it's just you, they're big, they're stronger than you can't do it. The vaccine gives you an opportunity to go recruit some friends. Your friends are your immune response, right? So what the vaccine does is it gives your immune system almost like a picture of that person. It says, this is what this person looks like. This is how you can fight them. Here are the special tools. Here are their weak spots. And then it tells your body how to make more tools to fight that person that you've seen, right? So the first shot you get, often, you feel fine. It's like, okay, I know what this person looks like. The second shot, there are 2 shots. The vaccine is a 2-shot series that is about 3 to 4 weeks apart, depending on which manufacturer you get. That second shot is basically like, oh, I remember what this looks like. All right, we need to start getting ready because it looks like we're going to have to fight this person that we've seen. And your heart starts racing a little bit. You start getting ready. You know, you're a little hot, right? Like you get some fevers because you're ready to fight. It's kind of your system kicking into gear and getting ready. And I probably didn't do her analogy justice, but that is essentially how vaccines work, right? Vaccines give your immune system the opportunity to create antibodies and an immune response once you encounter a virus that is occurring. And so once you encounter that virus, your body already knows what it looks like. It already knows how to handle it.
Wow. Is the CDC maybe, are you all preparing a hater vaccine, if you will? Like that would be sweet. My body actually knows exactly how to respond to these haters. But I will ask you, is there a natural reaction to vaccines in general that people should be cautious of or be looking forward to? That way they don't confuse their body's reaction to the vaccine for them having whatever the thing that they're trying to be vaccinated from?
Yeah, I think that's a great question. Go ahead. Whoever was going to answer that.
I was going to say, I think we should keep in mind that the body reacts to anything that's foreign to the body. And we have to think about, you know, I have a lot of friends who eat crabs and say, well, I'll just take some Benadryl and I'll be okay. And that is also a reaction that the body has. And the mRNA that is put into the vaccine is another example of it. And it happens to be from the COVID virus. But in this case, it is, again, a reaction from a different substance coming into the body. So just to keep in mind that the body always reacts to something that is foreign to it. And this is just along those lines. And so that's what I would say about the reaction there.
No, thank you so much. And Deborah,
there was another piece that you mentioned. There was another piece that you mentioned about reactions that we're seeing in the population, right?
Mm-hmm.
And I think it's important to also realize that we've never had a vaccine rollout be public and on social media before, right? So things that would normally be reported in really small numbers, and they are relative to the population of people being vaccinated, we're talking really small percentages of people that are having reactions that would normally occur with any vaccine. And it's just something that happens to them specifically. But we're able to see more of this in real time and publicly, which is great that we're able to be informed. But for context, we weren't seeing that before. And so it feels like every reaction that we see is unusual to us when it's actually not unusual. It's something that we've seen in the past.
Oh, that's super helpful. And then Deborah, were you leaning in on that question or were you?
I wanted to ask Dr. Johnson because she shared something with me earlier because she has now received both your first and your second dose.
This is my first. I haven't got my second yet.
But are we seeing, and Dr. Antoine, you've had the second?
Okay.
Can people expect to see any kind of differences, or do we have any information about differences in the first versus the second dose in the immune response?
Yes, and one, there's actually published data on that in the New England Journal of Medicine that shows the response to the second dose. So it's almost like, when you get the first, you get here with your antibodies, and then when you get the second, you go up here with your antibodies. So that has been shown to show that you have a better immune response after that second dose. What people are saying is that there's a little bit more of that response, like Dr. Edwards-Johnson was saying, in terms of your body's a little bit more revved up. So you'll feel a little bit more of that response as well. The arm will ache a little bit more. You might feel a little bit of the response in terms of some fatigue. Some people have talked about headaches, and that's the extra response that's come through. And that's what I've experienced as well. And it'll last maybe about a day and a half. Is it something where it has put people into the hospital? Not at high rates at all. And that's the limit of what we know in terms of the second dose response.
So people might expect, because what I'm concerned about is that people will get that second dose and go, I knew it. I knew I shouldn't have got this thing. So that's just our body is more revved up. So the response might be higher.
And I think the title of this series, A Candid Conversation, is what we should really be coming with. Not to say it's all the same, it's, everything's going to be nothing. It is to say the body's getting trained for this, and it's a little bit higher of a response, and it's going to feel different than the first dose. I want to be upfront in that. I got my second shot on Sunday, and so Monday and Tuesday I felt a little bit different, but I was still at work. I was still able to function. I operated a couple clinics, and I was able to do that well. So it's not that I have to stay home and go to the hospital or even take Tylenol or anything. I had my tea and I kept on going. So that's the limit of the response that I've experienced. And that coincides with what, the data is out there in the New England Journal to say it will be a bit of a higher response than the first one, but not something that's going to require you to, to stay home for the whole time.
That's super helpful. And so Brenda Brown asked a question about pre-existing conditions. So she says, what about folks with pre-existing conditions? Do we need to wait until our age group is mentioned? If we have, I would say, if I'm paraphrasing here, the combination of being 63 with a heart disease. So Dr. Johnson.
Yeah, right now, in my experience, it has been entirely age driven for now, but that pre-existing condition age group will be closely followed. And a lot of it, again, just depends on resource allocation, how much of the vaccine is available, where it's available. I expect that in the next month or two, we are going to see the vaccine even more readily available. And that will be completely despite whatever your age group category might be or pre-existing category might be. It is hopeful that we will be able to kind of go to a Walgreens, for example, and be able to get the vaccine similar to how we do with flu shots. So I am optimistic that we will have opportunities. But for right now, 75 and over appears to be prioritized, followed by 65, and then those with chronic health conditions.
And so I do have a follow-up question to that. One is just as we think about it, I know locally, and either you or Dr. Deborah Furr-Holden can maybe answer this one locally. I know we've switched, and not because one vaccine is better than the other vaccine, but I think we switched to Moderna from Pfizer because there's more available because of some rollout. And so this is stuff that I'm hearing, you hear stuff on the streets. And so I'm trying to bring it here so I know whether or not it's true or not. Is there a switch, and is there something people should be worried about with that switch?
I would say you should not at all be worried about the two different vaccines. The vaccine data, the amount of people they had in their study, the demographics of their study are very, very similar. There are some differences in how the vaccines are stored. So the Pfizer vaccine, you might have heard, has to be stored at a really cold temperature, and that requires some different places to hold it, right, to make sure you're storing it. And so there have been people who have gotten Pfizer vaccine or have gotten the Moderna vaccine. If you are listening to hospitals, they're just getting the vaccine as it comes. So there's certainly no prioritization that I've seen. People are getting it where they can. There is a difference in the amount of time between the first and second dose for each vaccine. So Pfizer is about 4 weeks, whereas I might have that backward. Pfizer, do you remember, Dr. Antoine?
Yeah,
I want to make sure I'm getting it. Pfizer's 4 weeks and Moderna is 3. Pfizer's 3 weeks?
Yep, Pfizer's 3, Moderna 4.
Yeah.
Okay. Yeah. So those are some of the differences, and we haven't seen any differences in the response or a reason to prioritize one over the other.
No, that's super helpful. And so I'll ask, the next question is from Monique Cordell. Hey, Monique. Actually, when I saw the last name, I was like, I know who that is. What's up? Question is, so are you guys recommending everyone get the vaccine shot there? So are you guys recommending on everyone getting the vaccine? And I will say, from the person who's maybe kind of leading the conversation, my perspective is about exposing people to the best information possible so they can make the decision that works for them and their families. But we do have a number of folks that are experts in the space, quite frankly, the health space. 3 docs on the line right now, which is why this is called The Doc Is In. Isaiah is not included in that space. If we want to talk about philanthropy, that's my space of expertise, but this is where I'm throwing to you all. One, are you recommending that everyone gets the shot, or are you just recommending that everyone has the best knowledge available? And either way, we can start with you, Dr. Antoine, and work our way through to Dr. Johnson and Dr. Furr-Holden.
Yeah, I think everyone should be informed to be able to make the choice they feel is safest for themselves. That's always been my standpoint out there. I've gotten it myself for my own reasons, which are I have to see patients on a regular basis. I'm in areas where there is a higher than normal chance of encountering COVID, so I thought it would be safest for me and the people that I would be around. I think folks should make that decision for themselves. However, this is an opportunity to have more people in our population with bodies that are trained to respond. And I think there's a history of us not being in this type of situation or able to get this type of preparation. And as we see more of the safety of it coming through, I think there's an opportunity for us to be at the forefront of this, like Dr. Furr-Holden is saying, rather than being at the tail end and potentially having harmful effects on our population because of the COVID down the line. So those are just my thoughts there.
No, thank you. Drs. Furr-Holden and Dr. Johnson, if either one of you can weave in an answer around herd immunity and maybe an explanation around herd immunity, that would be super, super helpful.
All right, I'll jump in real quick. And
yeah,
I'll throw it back.
You have a line that's perfect.
Oh, I'll be forgetting this stuff. So you go ahead and throw that line in.
No.
I've ever shared with you, you take it. The thing I'm now trying to really remind people of when it comes to herd immunity, because I've heard people say, oh, I'm just going to wait for herd immunity.
Mm-hmm.
I don't have to get it. If enough of y'all get it, I'm good. Okay. And so there's a couple things. One, the main goal of herd immunity is to stop people from getting the disease, to stop people from getting sick in the first place. This is not a disease where we want to get to herd immunity with the lion's share of our population getting sick and the virus doing whatever it does in their body, them living with the virus and getting sick for weeks and then living with whatever long-term consequences. That is not the public health model of how and what we try to accomplish with herd immunity. The whole goal with herd immunity is that we will have enough people in the population who are protected that the likelihood of them infecting somebody else is really, really low. Dr. Bobby said it great. He said, imagine if you got a lot of people in line. If person number 1 is sick and everybody is immune up until you get to person number 6, person number 1 and 6 are so far apart, the likelihood of person number 6 coming in contact with person number 1 is really, really, really low. What we don't want to have happen is everybody in line gets sick and develop personal immunity. And we're just learning that personal immunity maybe doesn't last as long as the immunity that you get from the vaccine. And so, again, if I go back to this Swiss cheese model, and I might go ahead and pull that slide up and just share screen real quick to show people after Dr. EJ talks. The vaccine is one important layer of many layers of protection that we're going to need to keep our population safe. It's not the only, I wouldn't even say it's the most important, but it is an important layer. And to specifically answer Monique's question, knowledge is power. If people have the knowledge and the good information, you weigh it all out, and at the end of it, you choose no, I'm okay with that. What I'm not okay with is people being a no because they think they're getting injected with a microchip, or they think that the vaccine is going to change. Really, that's a myth. Or they think that they're going to get the virus from the vaccine. The vaccine does not contain the virus. So I'm not okay with people being a no because of myth and because of bad information. Knowledge is power, and I just want people to have what they need to be empowered in their choice. I do believe that if people really get the information, I would find it hard to believe that the lion's share of us wouldn't choose to not be at risk for getting infected and infecting others, and instead would choose to run the risk of potentially getting sick and living with whatever outcome comes from that.
So Dr. Deborah, I will ask you, is Dr. EJ a thing? Is that?
Yeah. Oh, Dr. EJ. Yeah, that's
perfect. We're cousins now. That's cool.
Yeah,
so Dr.
yeah.
EJ, you're on.
Done. No, so Dr. Furr-Holden had a really great line in one of her op-eds, and it was this idea that we've told a lie of omission around herd immunity, specifically as it relates to Black and Brown communities. And we've talked a lot about Black and Brown communities and some vaccine hesitancy or having some concerns about the vaccine. And we haven't talked about the idea that it requires many of us, lots of us, the majority of us, to get vaccinated to reach herd immunity as well. And we haven't had that discussion that we all sort of have to be a part of this process in order for us to reach herd immunity. I 100% agree with my colleagues. You have to be able to be informed. No one should make the decision for you. You shouldn't feel as if someone has made this decision or pushed it upon you. It's a decision that you should make, but you should make it with all of the correct, the most factual data. And you shouldn't have to make the decision because you are unable to access data, because no one has told you, because no one has answered your questions. And I think that's the most important piece. I just want people to be informed and know.
So I got a question from a good friend from CMU, Brandy McNeil.
Oh no, go green.
Fire up, Chips. So what are your thoughts regarding where we go from here? So there's a series of questions here, and they kind of have a theme. And so whoever wants to jump in just after I finish it, after I say COVID strain at the end, then you'll know, jump in. What are your thoughts regarding where we go from here? Once vaccinations really get going and many people are vaccinated, what does our world look like? Should we still be wary and cautious of future pandemics? What about those that don't get the vaccine? Could there be a resurgence of another COVID strain?
I think we need to make sure that vaccine isn't, kind of linked together with end of all pandemics. I think this is to stop a form of the virus. And just like with the flu vaccine, viruses are tricky things. And still, I think there needs to be safety precautions that need to be kept in place. Masks, I think, are going to be here for a little while. Some folks are saying 2022. Just to put it out there, not just the summertime. So it means that the folks that aren't getting the vaccines, they're going to need to be extra precautious, and the folks that are going to, still have the be vaccinated, they need to be precautious, because just because they can fight off the vaccine doesn't mean they can't pass it on to someone else. And so that
you mean fight off the virus? Fight off the virus. Yeah,
that's correct. Fight off the virus. Thank you for correcting me there. So I think we still need to have the precautions in place for a little while, and I hope there isn't confusion, but I think there's a possibility for confusion that once you get the vaccine, you can do whatever you want and you're good to go. There still needs to be thoughtfulness for all the people around them. So those are my thoughts there.
I would echo those sentiments entirely. We don't have data on the ability for the virus to be transmitted by people who have gotten vaccinated. So you could be a vaccinated person and still take the virus to your grandmother who might not have been vaccinated yet, or your friend who might not have been vaccinated yet, right? You might be protected, but people who might not have been vaccinated might not be as protected. I feel like I'm going to be wearing masks through 2022, as you alluded to. I wanted to mention this idea about the strains, because we've had some questions. I've had personal questions about, so do we think this vaccine is going to be efficacious against this new strain that we're hearing about? And, certainly we've had to have new vaccines with the flu virus, for example. We have a new vaccine every year. And that might end up being the case for COVID, where we have to have a new vaccine every year. But I think largely right now, we feel pretty confident about where we are with respect to different strains, because the vaccine isn't against just one tiny little piece and one tiny little protein, right? It's against the spike protein. And when mutations happen, or when the virus changes, it changes in a very small way. And the vaccine really helps your body respond in a way that it's kind of bringing out the guns against that whole protein, not just a tiny little part of that protein, but the entire protein, right? And it tells your immune response, this is what we're looking for. And so when those mutations happen, when you hear about those mutations, certainly there's a risk that maybe the vaccine won't work, but we feel good about it now, because those mutations tend to be really small, and they tend to really not be things that kind of wipe out the vaccine's ability to work.
No, I appreciate that. And I'm gonna ask a question about the vaccine and how long it lasts before you need to get a booster. And that question is up as you all think about it. But there's a question coming up from Sean a little later, and it talks about his son having diabetes. And it just reminds me of when I was a kid and we had a rotary phone, obviously, on the wall. And then there was this number that you could call called Ask a Nurse. And you can call it Ask a Nurse, and you could ask that nurse any questions about what was happening with you at home. You didn't have to rush to the hospital to get there. Obviously, this was before cell phones and all of that. We had an answering machine, so if they called us back, if you will, we can play it on that little tape. I have no idea what we did with all of those little tapes. But that's it. We do have an opportunity now where we have 3 amazing doctors on the line for at least the next 30 minutes or so. So I would just encourage folks to share with your family, share with your friends, share with your Facebook friends this post. That way they can jump on and maybe answer direct questions. I'm going to try to rapid fire get through the rest of these so that we have a lot of room for new questions that may come about. But I just want people to take advantage of the opportunity that we have before us. These are amazing docs that are doing incredible work, quite frankly, doing direct service work right now in their day-to-day. And they've spent some time with us this afternoon or this evening to answer questions. And so this question about diabetes made me think about those unique experiences or those unique situations that exist out there, and people may need questions answered right away. So I have a son with diabetes. Will it be good for him to take it or not?
You like how I just threw your face in the main screen? You're the family
So I have
physician.
to answer
But you
it.
threw him in the main. Okay.
I will say
No.
one thing. The one thing I will say is right now, I don't think anybody under 16 is even
I was
eligible
gonna-
for the
That
vaccine.
was
So
going to be
that's,
my,
yeah.
Okay.
yeah. So we have Pfizer specifically, and some of the studies go as far as 16, like Dr. Furr-Holden alluded to. But we don't have data on kids yet. And I think the first study started recently. So it'll be, a few months before we get that data. But if your son is over 16, that's a really good conversation to have with your primary care doc about, my son has a pre-existing condition. I think he's at higher risk. What do you think? Is this a good decision for him?
And I think maybe what they're,
Go ahead.
I think the thing that people are getting to is, does diabetes preclude you from getting the vaccine?
No.
Yeah.
And I think that what we talked about before in other talks is this is a great opportunity to make sure all those pre-existing conditions are tuned up as best as possible, because if they're not tuned up, that could make other conditions hard to deal with as well.
Yeah. So next question, and I think let's go back to that question around if you get the vaccine around boosters. So, and you had posted that question a little bit earlier, Dr. Deborah.
Yeah, that's the home team. That was Janae.
Ah, okay. Home team asking the tough questions. Talk to us about the need for boosters. So how long does the vaccine last before you need a booster or need to get a booster? And quite frankly, the question is about how long does the immunity last in the vaccine? And so how long is it? Are we predicting an annual vaccine? You got to get it every year. Are we predicting that this may last for the rest of your life? Like how long is the immunity that the vaccine offers for the body?
So I've been kind of keeping up with some of the data with that. The most recent article that got published 7 days ago in the New England Journal of Medicine said that the antibodies last for 119 days. So that's the number that we have. That's the most recent data we have. So I think that is as far as we can predict right now. There aren't recommendations as to when the next booster is going to be needed, but in terms of how long the antibodies last, that is the number.
All right. That's helpful for my folks. We're thinking like, okay, simple math. That's about 3 or 4 months or so I can last before. So the next question we have here, Anthony Ray Dunn says, couple of my hospital coworkers have just gotten the second dose. Their response have been pretty. Oh, this is just kind of give us an update. Same head, fever, fatigue for about a day. Anything beyond just those two? And I know you, Dr. Antoine, told us a little bit about your experience with the second dose. Anything that you would add to this idea of head or fever or fatigue or those general things that happen after you have the shot?
Honestly, not really. I think it's just making sure you understand the timing of when it might occur. And some of the folks at my institution are saying about 12 hours, 6 to 12 hours afterwards. That's when you should expect that. So it's not like, and for me, it was around dinner time. So I thought I had a meal. I'm tired. I thought it was, but then I was like, wait a minute, this is something else. And then when I thought about the timing, it was that 12-hour mark, about actually 11 hours after my shot.
All right. And then I'm going to roll right into.
My colleagues are seeing the same. Sorry. My colleagues are seeing the same 12 hours. The thing I would say is, for sure, if your symptoms last more than 48 hours, you need to be talking to your doctor and considering getting a COVID test, right? Because it does not mean that just because you have the vaccine that it's not possible that you contracted COVID a couple days before you got vaccinated, et cetera.
Oh, we got a good question coming later. I just saw it. I just had to make sure that I spent some time getting to it, but it's good. You see it at the end there, Deborah. So let me get back up to this question that I had just before. So Anthony Ray, what's up? Sorry, I'd be knowing who people after a second. I'm like, I know who that is. So a couple of my hospital coworkers have gotten the second dose. That was the first question. The second question that he had was, I've had COVID before. I've had COVID. Should I get the vaccine? So this is really asking a question about the difference between the immunity that you get by getting the vaccine or some natural immunity that you get by having it. So if you've had COVID before, should you still get the vaccine?
Again, going back to some of those same articles, people who get the natural virus, the antibodies last for about 50 to 60 days. So depending on when you got it, it seems like an opportunity to go and still get the vaccine.
Thank you very much. And then Karma Lewis says, if my mom gets vaccinated, will she still pass the virus to others? So is there a period of time between getting the vaccine and your ability to still be an asymptomatic carrier to other folks who may have it?
I'm going to say something and then I'm going to throw it back to the docs. It's not even about being an asymptomatic carrier. Mm-hmm. The vaccine, in an ideal world, it will stop your body from replicating the virus. But remember, this is something that you're breathing in and you're breathing out. So let's say you're vaccinated and you're somewhere and you breathe the vaccine, you breathe the virus in. It's possible that you could breathe that same virus back out. You will not be asymptomatic because your body will never actually replicate the virus. So remember, this is a virus that you breathe in, you breathe out. So if you breathe that virus in, you could breathe it out in theory on somebody. You could be exposed in the market. You're on aisle 3. Your husband's on aisle 5. Y'all meet up. You get in the car. You got exposed on aisle 3 and you breathe it on him in the car. That is actually possible. It doesn't sanitize the airway. Go back to what Dr. Bobby was talking about when people get the nasal flu vaccine, that's sanitizing your airway. This is a future of vaccines to also have the vaccine be operating in the space where the virus takes hold and is actually being passed from person to person. And the airway is a critical piece of that formula.
So hold on. So that breaks the internet for me. So you mean to tell me I could be vaccinated, right? And say my wife is not. I could breathe in the virus, vaccinated, it not bother me, but still be a carrier to other folks who have not been vaccinated
for some potentially brief period of time.
For a small period of time.
But I think what we talked about earlier touches on this. What the vaccine is about is training the body.
Yeah.
So you're saying, all we're saying is there are going to be people that are trained, but there's still going to be people that are untrained. Everyone's running the same race here.
Right.
Wow.
And so if you're saying that you're just going to put everyone through the same race, realize there's still going to be untrained people, and we got to keep that in mind.
Wow. This is super helpful. I mean, I learned something every time. That was one of those moments where it's like, okay, Isaiah, get with it. So Becky Salter says, if you are breastfeeding, and I think you talked about this earlier, Dr. Antoine, if you're breastfeeding, is there any concern of the vaccine harming the baby if mom has been previously vaccinated for COVID?
I think Dr. EJ touched on it too. I think we don't have enough data to say exactly that, especially since it wasn't tested in children. But if there's a severe adverse event to the vaccine, then it might be an opportunity to stop breastfeeding. But I think for right now, the recommendation would be to continue breastfeeding.
All right. And now we got Showtime Jay Hairston II. Considering the history of abuse, mistrust, and mistreatment of communities of color in healthcare from the United States, how do we encourage communities of color to be vaccine compliant? In essence, how do we say to Black people, you can trust it or you can trust this?
So I'll jump in real quick, because what I don't give people is I don't give them hope. I don't feel like I can give anybody hope. I can give you the data, the information, the facts, and you can generate your own hope. The same thing with trust. I don't think I feel comfortable saying these are the facts. You can trust this data, you can trust this information, right? To tell anybody you can trust it, I'm not quite sure what it is, but what I can tell you is You will not get COVID from the vaccine. Getting the vaccine will severely decrease the likelihood that you will have an active case of COVID. And if you do develop an active case and are in that, 5-6%, what we call kind of the fail rate, the people who will get vaccinated and will still get it, you will have a substantially milder case than you would if you weren't vaccinated. I can tell you, you're not being injected with a microchip. There are certain things I can tell you, and you can trust that. My concern is this: because communities of color valid mistrust is so high, I don't want us to miss out on something that potentially will do us good, that potentially will keep us protected. It's not the only thing, but again, it is an important piece of the equation. I worry because I say people have just enough information to be dangerous to themselves. I watch people take one piece of good information and one other piece of good information way over here. There's a big gap in knowledge and understanding. And the leap that they make, or even worse, jumping way over to the left, that gap in misunderstanding and lack of knowledge worries me. I don't want us to fall into that gap. And I don't want our mistrust to have us not be the beneficiaries of something that I now feel better about saying I ultimately think is going to be in our best interest.
Dr. Deborah, tell us where you started on this journey. I was around when you first gave your first answer about whether or not you were taking the vaccine.
I was a heck no, you get it. And I ain't gonna lie. I was a heck no. You know why? And I literally I was indignant on calls with some folks from FDA, my partners at National Medical Association, different people. I said, where's the data? Y'all didn't rush this. It went at warp speed. I had the same hesitancy and the same skepticism that other people had. And they said, well, Deb, that data is up on the FDA website. Now, mind you, if you aren't a data person, it might be like reading something in Chinese, right? But I am a data person. I said, what? They said, yeah. And the findings from the Data Safety and Monitoring Board, the independent third-party group that's chock full of professionals with the credentials and the expertise to evaluate all of the data from the clinical trials, those conversations and the transcripts from them are actually all available in the public. I was shocked. I was like, oh, wait, there's full transparency on this? I've been talking to colleagues in the UK. They don't do that over there. Over there, you literally just got to trust it. Our process here is very transparent. So I actually wrote out for myself, why are you a hex no? What do you need to make an informed decision? And when I wrote those things out, I just started knocking them out. I got all my questions answered. And again, remember, I'm a data person. So I wanted to see behind the curtain. And as it turns out, a lot of what people like me want to see in epidemiologists so that I can be a credible messenger to people in my community is actually available in the public.
I think I think that history of mistrust, or quite frankly, our country's history of the exploitation of Black bodies, give us the reason to not trust, and also arms us with this kind of innate ability to say, I reserve the right to question everything and everyone. And so that protection that we've offered us, that barrier that we've offered between us and our families and decisions that we make is it can be helpful, or it can be a barrier for good information. I mean, people use those same types of analogies when they talk about their heart, right? I got this wall around my heart. Once you get in, you're in, but it's going to be hard to get in. It's the same thing with decisions like this. Dr. Johnson, I know you've had to have tough conversations like this, I'm certain, with your family, maybe even with that cool guy that's got all them J's in the background. Like, what has the conversation been like with your friends and family? Because when you get a doctor in the family, every question about health goes to the doctor in the family. So what are you saying to your family and friends about this?
The first thing I say is I'm going to get it, right? I think you can't advise people to do something that you're not going to do. And I was exactly where Dr. Furr-Holden was. I wanted to see the data. And I say that because I think it's important for people to realize that people don't just get here to say like, oh, I think everyone should get vaccinated. That is not where I was. I wanted to know that this was something safe. But for me, I also saw people with COVID, right? Like I saw people who were sick with COVID. I saw people who had what we call long haul symptoms, and 4 months out, we're still dealing with the effects of COVID. So, my my conversations with the people I love are just honest, right? They're candid conversations, for lack of a better term. They're real. And we sit and we talk about the things that people are concerned about. You know, what is this mRNA that we're putting in my body? How do I know that that's safe? And we talk about all of those things. And it gets back to those key principles of having data from people that you trust, seeing people that you trust, and getting those questions answered. And once I was able to do that, I think I have cultivated a trust with some of my patients and the people that I love, and we have those conversations, and then they make the decision that's right for them.
And Dr. Antoine, I'll ask you this, and I'm going to offer some context by just saying, as a brother who has probably grew up listening to folks talk about the Tuskegee experiment and what happens to Black men and Black bodies during clinical trials and that kind of stuff, or doesn't happen to Black men during clinical trials, right? How has all of the history and what we understand around mistrust impacted your decision to get this, and what got you over it? What made you say, you know what, with all of that, I'm still going to do this?
I think it's a question of history versus the role we want to play now. And I think that the history is very clear. The history is very strong. The history is still with us in terms of how people of color are disproportionately affected. However, the role we want to play now is also very clear. We are dying much higher than everyone else. So it's a question of, do I sit back and say, I'm just going to let this potential solution slide on by and not try it out to see if it's helpful, or do I play that role? And me, where I work, seeing people in homeless shelters, substance abuse, opioid epidemic, I said I can't pass this up as an opportunity to play that role. So it was a different situation for me, because I'm more so seeing people who are dying now and saying it's not a time to focus on the past. This is a time to say, what can we do now?
No, thank you so much. Thank all three of you for that answer. So I have a question around insurance, or quite frankly, I'm going to take Brenda Brown's questions and Monique Cordell's question and maybe combine them. One says, if a person doesn't have healthcare insurance, are they still able to get the vaccine? And then the question that Monique is asking is it the same? So we heard these things. I mean, obviously, we've seen the Vice President of the United States of America take it, right? And then we've also heard, well, we want to see mega sports stars. LeBron James has 49 million followers. How great would it be if he took the vaccine for his followers to see? Or how great would it be if Michelle and Barack actually took the vaccine on TV? What would they do to encourage us? And I think people are asking that question. Are they getting what I'm getting? Is Moderna and Pfizer and those two vaccines the only two that's available? And if I see that, are my eyes fooling me? Is this another trick on people of color or people that live in marginalized populations in areas with high concentrations of poverty? Like, what does it mean for us that you're showing this on TV and you're telling me I should do what they're doing? They got better insurance than I do, so they have a better version of it than I do. So if you can answer those two questions, one, healthcare insurance, if you can get it without insurance, and then the second part of the question, is it the same for all of us?
I'll take the insurance question, because I always tell people there's free. And then there's free. So originally they said it would be free. And what was free was what was in the vial, right? What was free was what was in the vial. And then there was all this conversation around, but what's in that vial has to get from the lab. It's got to be transported. It's got to be stored. Freezers got to be purchased, depending on which vaccine it is, the special freezers. Somebody's got to get it from the vial into your arm. So there was early conversation that said, well, what's in the vial is free. The government has already paid for that. So what is in the vial is free. And there's been a massive movement, both with the coronavirus task force, the federal task force, and then the congressional task force that my guy, Leon McDougall, who's the president of the National Medical Association, sits on for COVID equity. So it is supposed to be free. So whether or not you have insurance, you're supposed to be able to get what's in the vial, which is free because the government has paid for it, into your arm if you don't have health insurance. If you have health insurance, and I will find out because I actually have chosen to get vaccinated. My number has come up. I will be getting vaccinated, my first dose on January 21st. I found out because my second dose was scheduled. They scheduled them both at the same time. 3 weeks later, I guess that means I'm getting the Pfizer. Flint has both the Pfizer and the Moderna, and I really don't care. I'm just happy that I had done the work and grappled before my number came up. But there's no Pfizer for poor. There's no vaccine that they roll out in the ghetto, and then one vaccine that they roll out at the White House, and then one vaccine. It's all the same vials. So there's one vaccine, and it is supposed to be free. No exchange of money for you to get what's in that vial put into your arm. And if you have health insurance, they will likely ask for your health insurance card, and your health insurance may be billed for the cost of getting the free thing into your arm. And if you don't have health insurance, you shouldn't have to have any exchange of money. If you do, that might be a red flag, but it should be free.
Thank you so much. So Sean says, I have one more question. Why aren't they, and I think he had to rephrase this later, why aren't they giving it to people in the hospital that come in with COVID?
I can take that. So the treatments for COVID can sometimes require you to have to wait until to get the vaccine. So when you come in and potentially you test positive for COVID and you have severe symptoms, there are a lot of different treatments that we can sometimes do. Some of them include antibiotic treatment, some of them include prednisone, and all of that might not make you in the best kind of physical health or have the best response to getting the vaccine. So you want to be kind of in your best health, able to respond, able to create an immune response, right? That's what the whole point of the vaccine is, to create an immune response. And you want your body to be in a setting in which it can create a robust immune response. And so that's usually not in the case when you are unwell, you have a fever, you're in the hospital. And that, to be fair, is largely the case with any vaccine, right? We don't recommend people get vaccinated if they're having a fever, even against the flu or anything else. So in general, we tell people to wait until they're well. They have been without a fever for, we say, 48 hours generally, before they get the COVID vaccine or before they get any vaccine.
And correct me if I'm wrong, Dr. Johnson, but I believe if you have been infected with COVID, there's a time frame that they recommend you wait in between when you were infected and when you actually get the vaccine. And I've heard different numbers, but it's somewhere between 60 and 90 days post-infection before you were to get vaccinated. And it's my understanding that your immune system is already ramped up, having fought off the infection. You wouldn't want to over ramp it up with the vaccine on top of infection. So you absolutely wouldn't want to give a vaccine to a known active COVID case.
So next question, I heard on NPR this evening that the vaccine is primarily going to the wealthiest countries first. Countries in Africa, for example, are being seemingly overlooked. How do we address this gap so that it doesn't come down to the rich are being covered or vaccinated and the poor have to take their changes?
I can answer that one. That is exactly what is happening. That is my thing, equity. That is exactly what is happening. Canada has enough vaccine to vaccinate all of their people twice. They have enough to give them all 2 doses. All of the big countries, remember, we live in a world where we place a hierarchy on the value of human life. You could have almost predicted that it would go exactly like this. We talk about COVID equity in this country, and that's why I'm telling people, go ahead and miss your number in line, because I am championing and doing everything that I can to make sure that we have global equity. It's disgusting. And the major countries and the more developed countries and the wealthiest countries have absolutely jumped to the front of the line because they use their wealth and their resource to do that. So it's nothing but the effort of people like me that is going to ensure, and me and many others, I'm not alone. There's a whole choir band of us all over the globe fighting for global equity. And the other thing, because this hasn't come up, but I'll say it, that one shot vaccine, when it becomes available, that doesn't have that cold chain reaction and those storage capabilities, Africa and other places need to be first in line to get that. You think you have a problem coming back to get a second dose? You haven't seen poverty or transportation barriers or healthcare access barriers until you've been to some of our poorest countries in the nation, where you go and you see people who look just like you, and they live in the kind of abject poverty that you can't even imagine. So we are fighting for global equity, and it is my demand that the single dose, less storage requirement vaccine, that the developing nations be first in line to get that.
All right, I'm going to ask a question. Oh, Dr. Linda Poley, and she's an attorney, and I actually want to add something to her question now that I'm reading it, and attorneys typically don't like for you to add stuff to what they're saying, but I love Linda. She says, what is likely to happen if we don't have sufficient people vaccinated to achieve herd immunity? And I will add to that, she asked the earlier question about whether or not herd immunity changed from city to city or state to state. And so quite frankly, there are 425,000 people in our county, 9.9 million in the state of Michigan, 328 million across the country. Like, does herd immunity change from number to number? And I would ask, even if we're not only talking about herd immunity, even if we think about the vaccine itself, what is the number of people that need to take the vaccine for it to really work for our broad communities, whether you're talking city, county, state, or national level?
These questions mostly are great for the physicians. I guess we're getting a whole lot of public health questions today. Herd immunity is like a dynamic formula, and I know people like answers. I will tell you, it's going to be somewhere on the order of about 70 to 80% of the population will need to be immune, right? That doesn't mean 70 to 80% of the population necessarily has to be vaccinated, because some people will have natural immunity. It looks like that natural immunity will be shorter lived than the immunity that you would get from the vaccine, but it's going to be somewhere on the order of 70, 80%. Now, that's a great question, Linda, because think about how you can get the averages. So if we've got 100% of people in, and I'm using examples in Flint, in Grand Blanc, and then we have 50% of people in Flint. Well, if you put those two together, it'll be an average of 75%. But there will be a lower level of protection in Flint if we only get 50%. Why? Go back to the analogy of people in line. If you've got 6, 7 people lined up in line and half of them are at risk for contracting the virus and half are not, and one sick person shows up, you got a 50-50 chance that that sick person is going to be in line next to somebody who's susceptible or in line next to somebody who's vaccinated. So herd immunity increases as the number of people in the population and the percentage of people in the population goes up. We'll hear a lot about national estimates, but Flint and Genesee County are specifically looking at the numbers in our community. There was a rollout today. We heard the numbers so far and how they're going. We will ideally need to get to that 70, 80% threshold in all of the communities across the country if we are to have global protection as a nation.
All right. One quick question. I'm going to rapid fire on these last 3. One quick question about kids. Should kids get the vaccine, or do you feel like they're going to have to get the vaccine before we can start school in the fall?
I think we don't have that data. I think it would be unlikely that that would be the case, because right now we're under emergency use authorization for people who are getting it in the public, which kind of implies that we can't require it for anyone. And I think that'll be the case. I don't think we'll have data soon enough for the fall to be able to give a blanket recommendation or requirement that kids will have to get it in the fall. The thing that we have seen with kids is that they've been fairly resilient. That doesn't mean that kids don't get sick. That doesn't mean that they can't get really sick. But we've seen, a fair amount of more positive evidence of how the virus affects kids than it does adults and people who are with pre-existing conditions.
Yeah. To answer Linda Poley's question about transportation, I'll just say I was on a call earlier today. I know for sure in Flint we don't have a plan in place to address transportation barriers, but with the Task Force for Racial Inequities, we've been working very closely with MTA, and we're going to continue to work with MTA to figure out how we can find some solutions to those types of problems. Jay Hairston said that infuriated me too, Dr. Johnson, and quite frankly, he's a local pastor, so I think he's part of your choir, Dr. Deborah. He said, is there anything that he can do to help fight your fight for global equity? And he's just a local pastor, but he's willing to do whatever he can, his church can. And so you have another person.
I will reach out. I will reach out.
I'm really excited to answer this particular question, and we'll make these last 2 our last 2. I have asthma. Is it okay for me to get the vaccine? Would I be okay? This is from Gilbert. And I saw someone tag Gilbert into the live, and then he came in and asked the question. So that's perfect. So
these are my DMV folks. DMV folks.
Perfect.
Help them out. I'm going to throw my DMV doc in here.
So I think it's, again, the priority is making sure that you stabilize the condition you have. That's the most important piece. There isn't data to say that the vaccine worsens the situation, but making sure that the asthma is under control is the most important piece, and making sure you have a connection to your primary care doctor, whoever takes control or takes care of that is the biggest portion of it. But there isn't any data to show that the vaccine itself would worsen the situation.
And I could imagine that if you don't get vaccinated and you have asthma, you are at high risk for a bad outcome from COVID.
So
People with asthma.
That I would say for sure.
My husband has asthma, so this is a conversation we've had pretty explicitly about, making sure to be thoughtful about that. And I would agree with the comments made. It's a conversation you should absolutely be having with your primary care doctor. But the other side of it is always, what is your risk of getting COVID, and how severe could COVID be in someone who has asthma?
That's perfect. And we're going to consider that our last. Oh, no, isn't the U.S. considered one of the richest nations? Yes. Why are we running short? Dr. Deborah, could you quickly answer that question? Why are we running short?
There's a supply demand issue. They can only produce the vaccine as fast as they can produce the vaccine. So we're not really running short. It's just we can't get it all out at once. If in an ideal world, if we could, there'd be enough for everybody to have 2 doses. They'd all be stacked up in freezers. We just have to produce it. Once we get everybody vaccinated or get to that sweet spot, we won't see this. It's just because it's new. Like, think about if you're making Thanksgiving dinner, if you only have a single oven, how many dishes can you cook at one time? We had the same issue with testing. The labs could only run as many plates as they could run to test people. So we're not running short. We're just, as fast as it's being produced and shipped out, it's being put in people's arms, which is a good thing. That's why it's important. Again, have your questions answered. Knowledge is power. Know and operate from facts. Be empowered in your choice, because when your turn comes up, you need to be ready to act.
All right. And so I'm going to say thank you. One thing I do know how to do and add is time. And I know for sure we started about 5 minutes on a running clock. It's 1:07 right now. And I do understand a little bit about social capital. And I've spent some of it making sure that you all hang out with us, but I don't want to spend too much, because when I call you, Dr. Antoine, Dr. EJ, I want you to respond. And so we're going to try to get you all off of here, but I'm also going to offer an opportunity for you to leave a last or closing thought for the listening audience. So I'll start with you, Dr. EJ, then you, Dr. Antoine. You can close us out, Dr. Deborah, and I don't have to say anything else here, because I'm just the sincerely ignorant guy asking the medical professionals the questions.
That's not even close to true. Not even close. My closing thought is thank you for coming here to be informed and to get your questions answered. And I'm happy to be here and be someone who can answer those questions. And knowledge is power. Educate yourself and get those questions answered.
Thank you so much.
And I would just echo the thanks that, this is a time when a lot of misinformation can often guide our decisions, and folks that came here have chosen to get information to guide themselves whatever direction they feel is best. But I think this is a great opportunity, hopefully, for everyone to get something that can be helpful to them and the people around them. So glad I was able to participate. Thank you so much. Dr. Deb.
Okay, well, I see a lot of my DMV folks shouting me out. So I do have to say it, go Braves. I saw my boy Chris White. That was my prom date. We went to the prom together, senior prom. I can't help it. Everybody get your questions answered. We'll be back. We'll try to do our best to hit the demand. I just appreciate Dr. EJ, and I really appreciate Dr. Antoine for coming and taking the time. And more than anything, I really appreciate you, Isaiah, for really saying we got to do this. We got to make sure our people have what they need. And I'm here to serve. So thanks for the opportunity to partner with you on this.
No, thank you all so much. God bless and good night. That was my Russell Simmons.